A deeper look at the link between lifestyle and disease. Introduction. The correlation between lifestyle and disease is gaining recognition as a pivotal area of health research. Numerous studies underscore how lifestyle factors significantly contribute to the prevalence of chronic diseases and multimorbidity. This report synthesizes findings from various sources to illustrate the complex interplay between lifestyle choices such as diet, physical activity, sleep, substance use, and stress management, and health outcomes. Key findings. 1. Lifestyle as a major health determinant. Research consistently shows that lifestyle choices are central to health outcomes. Approximately 60% of health-related factors are linked to lifestyle, leading to chronic diseases such as obesity, cardiovascular disease, and depression. Unhealthy behaviors like poor diet, sedentary lifestyle, and substance abuse are prevalent globally, posing significant public health challenges. 2. Multimorbidity and lifestyle factors. Multimorbidity, defined as the coexistence of two or more chronic diseases, is increasingly observed in populations. A large population-based study emphasized that lifestyle factors, specifically physical inactivity, chronic stress, inadequate sleep, and smoking, are prevalent among individuals with multimorbidity. These behaviors correlate with significant chronic diseases like cardiovascular disease, cancer, and type 2 diabetes. 3. Specific lifestyle factors. Diet. A poor diet is linked to obesity and other health complications. Diet quality is a significant determinant of health, with unhealthy eating patterns leading to adverse health outcomes. Physical activity. Regular physical activity is crucial for maintaining health and preventing diseases. The lack of physical activity is a strong predictor of chronic conditions. Substance abuse, smoking, and excessive alcohol consumption are associated with numerous health issues, including respiratory diseases and cancers. Stress management and sleep hygiene. Chronic stress and inadequate sleep are emerging as critical lifestyle factors impacting health. Poor sleep quality exacerbates health conditions and contributes to a decline in overall well-being. 4. Technological influence. The role of technology and modernization in exacerbating unhealthy lifestyles is noteworthy. The overuse of technology, particularly in the form of screen time, negatively affects physical health and mental well-being. 5. Socioeconomic factors. Educational attainment and socioeconomic status significantly influence lifestyle choices and health outcomes. Individuals with lower socioeconomic status often exhibit higher rates of unhealthy behaviors and poorer health outcomes. Timeline of events. Recent decades, an uptick in research interest concerning lifestyle factors and health outcomes, revealing a direct correlation between lifestyle choices and disease prevalence. 2023, a pivotal cross-sectional study involving 345 adults provided empirical evidence highlighting the rising prevalence of multimorbidity and the significant role of lifestyle factors in this trend. Discussion. The link between lifestyle and disease is multifaceted and has profound implications for public health interventions. The integration of findings from various studies emphasizes the necessity for targeted lifestyle modification interventions to enhance health outcomes and mitigate the burden of chronic diseases and multimorbidity. 1. Importance of lifestyle interventions. Public health strategies must prioritize lifestyle modifications focusing on promoting healthy eating, increasing physical activity, and improving sleep and stress management techniques. Such interventions can potentially reduce the prevalence of chronic diseases and enhance the quality of life for individuals with multimorbidity. 2. Challenges and barriers. Addressing lifestyle-related health issues involves overcoming barriers such as economic constraints, lack of access to healthy food options, and the pervasive influence of technology. Public health policies must consider these challenges to implement effective interventions. 3. Future directions. As research advances, it will be vital to refine strategies that address lifestyle factors within diverse populations. Collaborative efforts among healthcare providers, policymakers, and communities are essential to create supportive environments that promote healthy lifestyles. Conclusion. The relationship between lifestyle and disease is complex, but it is clear that lifestyle choices are critical determinants of health outcomes. The integration of findings from multiple studies underscores the importance of lifestyle interventions in preventing chronic diseases and addressing multimorbidity. As the field of health research continues to evolve, a concerted effort to promote healthy lifestyles and mitigate risk factors is essential for improving public health. Future studies should aim to explore the nuances of lifestyle factors and their impact on various populations, further illuminating the path toward healthier societies. The exploration of the link between lifestyle and disease reveals several counterintuitive insights that challenge conventional wisdom. Here are some notable points. 1. Inactivity and multimorbidity. It is commonly believed that physical inactivity is a straightforward risk factor for chronic diseases. However, the data indicate that individuals with multimorbidity exhibit lower levels of physical activity compared to those with a single disease or no disease at all. This suggests that while inactivity is a significant risk factor, it may also be a consequence of living with multiple chronic conditions, creating a complex feedback loop where disease leads to inactivity, which in turn exacerbates health issues. 2. Alcohol consumption. Contrary to the stereotype that heavy drinking is a hallmark of unhealthy lifestyles, the study found that participants with multimorbidity reported lower alcohol intake. This could reflect lifestyle changes prompted by health concerns, where individuals reduce alcohol consumption after being diagnosed with chronic diseases. The implication is that lower alcohol consumption might not always indicate a healthier lifestyle but could be a reaction to existing health problems. 3. Higher stress levels. While stress is widely recognized as detrimental to health, the relationship between stress and multimorbidity is particularly striking. Individuals with multiple chronic diseases reported significantly higher levels of chronic stress, suggesting that stress management is crucial but often overlooked in managing patients with multiple health conditions. This counterintuitive association underscores the need for integrated approaches that include psychological support in health interventions. For diet quality and multimorbidity, the expectation might be that individuals with chronic conditions would have poorer diet quality, but the findings indicate no significant association between diet quality and the prevalence of multimorbidity. This raises questions about the complexity of dietary impacts on health, suggesting that dietary patterns alone may not be sufficient to predict the presence of multiple chronic diseases. 5. Social relationships. It is generally assumed that social connectedness contributes positively to health outcomes. However, individuals with multimorbidity were more likely to report being single but had larger social networks. This suggests that while social connections are important, they may not directly correlate with the absence of disease. The dynamics of these relationships might play a more nuanced role in health than previously understood. 6. Sleep duration. The common belief is that inadequate sleep leads to various health issues. However, the data show that individuals with multimorbidity often report poor sleep quality and inadequate sleep duration, indicating that sleep issues may arise as a consequence of living with chronic diseases rather than being a primary risk factor. This highlights the need for a multifaceted approach to health that considers how various factors interact over time. 7. Substance abuse. The research indicates that former smokers had a higher odds ratio for multimorbidity compared to never smokers, which contradicts the expectation that quitting smoking would always lead to improved health outcomes. This suggests that while cessation is beneficial, the act of having smoked previously may leave lingering health impacts that contribute to multimorbidity. 8. Technology's role. While modern technology is often seen as a facilitator for unhealthy lifestyles, e.g., sedentary behavior due to screen time, the studies did not thoroughly analyze technology's impact. This absence of focus raises the question of whether technology is inherently harmful or whether it serves as a tool that can be leveraged for better health management if used appropriately. These counterintuitive findings emphasize the complexity of lifestyle factors and their relationships with health outcomes. They suggest that simplistic views of lifestyle choices as direct causes of disease may overlook the intricate interplay between health behavior and social contexts. Future research should continue to unravel these relationships, considering the multifaceted nature of health and disease management. The report highlights critical insights into the association between lifestyle factors and the prevalence of chronic diseases, particularly focusing on multimorbidity. Here are some significant aspects that many might overlook. 1. Emphasis on multimorbidity. While much health research emphasizes single chronic diseases, the concept of multimorbidity, where individuals have two or more chronic conditions, deserves more attention. The findings underscore that lifestyle factors such as chronic stress and inadequate sleep are strongly correlated with multimorbidity. This is significant because addressing multimorbidity could improve quality of life and reduce healthcare costs, yet it remains under-discussed in mainstream health narratives. 2. Complex interaction of lifestyle factors. The interplay between various lifestyle factors is intricate. For instance, while physical inactivity is commonly recognized as a risk factor, the report notes that individuals with multimorbidity often exhibit increased levels of chronic stress and poor sleep. This suggests that intervention should not target lifestyle factors in isolation but rather consider the holistic interactions between them. The complexity highlights the need for integrated approaches in health promotion and disease prevention strategies. 3. Underappreciated role of stress and sleep. The report emphasizes chronic stress and inadequate sleep as critical lifestyle factors linked to multimorbidity. These elements are often overlooked in discussions focused on diet or exercise. Understanding the significant role that psychological factors play in physical health can lead to a more comprehensive approach to health interventions, incorporating mental health support and stress management techniques. 4. Counterintuitive findings on substance use. The report reveals that individuals with multimorbidity reported lower alcohol consumption and a higher likelihood of being former smokers. This might seem counterintuitive, as one might expect higher substance use among individuals with multiple health issues. This finding indicates that lifestyle changes often occur in response to chronic health conditions, suggesting that health practitioners should consider the transformation in behaviors post-diagnosis when designing interventions. 5. Impact of technology. Source 1 discusses the negative influence of modern technology on lifestyle. Although the report does not delve deeply into technology's role in lifestyle-related diseases, it raises awareness of the increasing use of digital devices leading to sedentary behavior and disrupted sleep patterns. This intersection is crucial as we navigate a technology-driven world, and understanding its effects on health can inform future public health campaigns. 6. Diverse definitions of lifestyle factors. The report highlights that lifestyle encompasses various domains including nutrition, physical activity, substance abuse, sleep, stress, and relationships. This broad categorization is significant because it necessitates that health professionals consider multiple aspects of lifestyle in their assessments and interventions rather than focusing narrowly on diet and exercise alone. 7. Socioeconomic factors. The relationship between socioeconomic status and health can often be underestimated. The report notes the influence of education and income on health behaviors and outcomes. By integrating socioeconomic considerations into health strategies, we can better target interventions to those most at risk due to their socioeconomic circumstances. 8. Need for tailored interventions. The report suggests that lifestyle interventions must be tailored to individuals, particularly those with multimorbidity. This is significant as a one-size-fits-all approach may not be effective and could overlook the unique challenges faced by individuals with multiple chronic conditions. Personalizing health interventions can lead to better adherence and outcomes. 9. Quantitative and qualitative relationship. The use of quantitative data to measure lifestyle factors provides a clear picture of associations with health outcomes. However, the qualitative aspects such as the quality of social relationships and emotional support require further exploration. Understanding these dimensions can enrich the development of comprehensive health strategies. 10. Public health implications. The integration of these findings into public health policy is essential. There is a need for health systems to prioritize lifestyle factors as fundamental components of chronic disease management and prevention. Public health campaigns should aim to raise awareness about the importance of lifestyle modifications and provide resources for stress management, sleep hygiene, and physical activity. In summary, the significant connections between lifestyle factors and chronic diseases, especially multimorbidity, highlight the need for a comprehensive integrated approach to health promotion that encompasses the complexity of lifestyle interactions, addresses psychological well-being, and considers socioeconomic factors. These insights can inform future research, clinical practice, and public health initiatives aimed at improving health outcomes globally. 1. Lifestyle as a major health determinant. Both sources emphasize the critical role of lifestyle in determining health outcomes, particularly in the context of chronic diseases and multimorbidity. Source 1 notes that approximately 60% of health-related factors are linked to lifestyle choices, highlighting that unhealthy habits can lead to conditions such as obesity, cardiovascular disease, and mental health disorders. Source 2 similarly connects multimorbidity, defined as the coexistence of two or more chronic diseases, with poor lifestyle choices. This point underscores the necessity for public health interventions that promote healthier lifestyle choices to mitigate the rising burden of chronic diseases globally. 2. Specific lifestyle factors contributing to disease. The analysis identifies several key lifestyle factors that are consistently linked to chronic diseases and multimorbidity across both sources. These include diet quality, physical activity levels, substance abuse, notably smoking and alcohol consumption, stress management, and sleep hygiene. Source 2's empirical evidence suggests that individuals with multimorbidity exhibit higher rates of physical inactivity, chronic stress, and inadequate sleep. This correlation emphasizes the need for targeted interventions that address these specific factors to enhance health outcomes and reduce disease prevalence. 3. The phenomenon of multimorbidity. The concept of multimorbidity is a focal point of the discussion, particularly in Source 2, where it is defined as the presence of two or more chronic diseases. The study highlights that multimorbidity is associated with poorer quality of life, increased healthcare costs, and higher mortality rates. The findings draw attention to the urgent need for healthcare systems to adapt to the complexities of managing patients with multiple chronic conditions. This point is critical for developing effective healthcare strategies and policies that address the unique challenges posed by multimorbidity. 4. Implications for public health interventions. The integration of findings from both sources suggests that public health strategies must prioritize lifestyle modification as a means to combat chronic diseases and multimorbidity. The evidence indicates that lifestyle interventions can improve clinical care, enhance medication effectiveness, and potentially support disease remission. Additionally, the discussion of lifestyle medicine as a new field emphasizes the importance of holistic approaches that consider psychological, social, and behavioral elements of health. This reinforces the need for comprehensive public health campaigns and policies that not only promote individual lifestyle changes but also create supportive environments conducive to healthier living. 1. The Framingham Heart Study 1948-present, launched in Framingham, Massachusetts. This ongoing study has significantly contributed to the understanding of cardiovascular disease. Researchers initially focused on the risk factors for heart disease but later expanded their investigation to include lifestyle factors such as diet, exercise, and smoking. The study's findings have been instrumental in establishing the link between lifestyle choices and heart disease, influencing public health initiatives worldwide. 2. The Nurses' Health Study 1976-present. This long-term study began with 120,000 registered nurses in the United States. It aimed to explore the effects of lifestyle factors on women's health, particularly regarding chronic diseases. Over decades, the study has provided critical insights into how diet, physical activity, smoking, and other lifestyle choices affect health outcomes, leading to recommendations that have shaped preventive health strategies. 3. The Diabetes Prevention Program DPP 1996-2001. This large-scale multi-center randomized clinical trial focused on preventing type 2 diabetes in individuals with prediabetes. The DPP examined the impact of lifestyle changes such as weight loss, dietary changes, and increased physical activity on the development of diabetes. The results showed that lifestyle interventions significantly reduced the incidence of diabetes, confirming the critical role of lifestyle in managing and preventing chronic diseases. Future outlook: predictions for the link between lifestyle and disease. As we look ahead to 2030 and beyond, the interplay between lifestyle factors and disease will likely evolve, driven by technological advancements, societal changes, and our growing understanding of health. Here are several predictions regarding the future of this critical relationship. 1. Increased focus on preventive healthcare. The shift towards preventive healthcare will continue to gain momentum. With the burden of chronic diseases increasing, healthcare systems will prioritize lifestyle interventions such as promoting physical activity, healthy eating, and mental well-being. This will be facilitated by integrated care models that emphasize preventive measures over treatment. Expect to see more health plans incentivizing patients to engage in healthy behaviors through discounts, rewards, and personalized coaching. 2. Personalized lifestyle medicine. As genomic and biometric data collection becomes more prevalent, personalized lifestyle medicine will emerge as a key component of healthcare. Individuals will receive tailored lifestyle recommendations based on their genetic predispositions, health status, and preferences. This approach will empower people to make informed decisions about their diets, exercise routines, and stress management techniques, ultimately reducing the risk of chronic diseases. 3. Technological innovations and wearable health devices. The proliferation of wearable health devices will revolutionize how people monitor and manage their health. Devices that track physical activity, sleep patterns, heart rates, and stress levels will provide real-time feedback, encouraging healthier lifestyle choices. Expect advancements in artificial intelligence to offer personalized insights and actionable recommendations based on individual data, promoting proactive health management. 4. Telehealth and virtual support systems. Telehealth services will continue to expand, offering virtual consultations for lifestyle-related issues. This will make healthcare more accessible, particularly for individuals in remote areas or those with mobility challenges. Online communities and support groups will flourish, facilitating shared experiences and encouragement among individuals striving to improve their health through lifestyle changes. 5. Integration of mental health and lifestyle strategies. Recognizing the interconnection between physical and mental health. Future healthcare strategies will increasingly integrate mental well-being into lifestyle interventions. Stress management programs, mindfulness training, and mental health support will be essential components of lifestyle medicine, addressing the psychological factors that contribute to chronic disease. 6. Community-based interventions. Public health initiatives will focus on community-level interventions aimed at promoting healthy lifestyles. Collaborative efforts involving local governments, schools, and organizations will create environments that encourage physical activity, healthy eating, and social connections. Expect more community gardens, recreational spaces, and health education programs to foster collective well-being. 7. Sustainability and food systems. The future will see a stronger emphasis on sustainable food systems that promote health. As awareness of the impacts of diet on both personal health and the environment grows, consumers will increasingly favor plant-based diets, local sourcing, and organic options. This shift will not only contribute to individual health but also promote ecological sustainability. 8. Data-driven public health policies. Data analytics will play a crucial role in shaping public health policies related to lifestyle and disease. Policymakers will utilize large datasets to identify trends, assess the effectiveness of interventions, and allocate resources more efficiently. This data-driven approach will enhance the ability to create targeted initiatives that address specific lifestyle-related health issues in populations. 9. Global collaboration and health equity. Health equity will become a focal point in addressing lifestyle-related diseases. Global collaborations will aim to reduce disparities by ensuring access to healthy food-safe environments for physical activity and mental health resources. Efforts will target vulnerable populations. Recognizing that socioeconomic factors significantly influence lifestyle choices and health outcomes. 10. Increased research and education. Investment in research focused on the relationship between lifestyle and disease will expand. Educational institutions will incorporate lifestyle medicine into their curricula, training future healthcare professionals to emphasize the importance of lifestyle factors in preventing and managing chronic diseases. Public awareness campaigns will further educate the population on the impact of lifestyle choices on health. Conclusion: the future of health and disease prevention will be increasingly intertwined with lifestyle choices. As technology advances and our understanding of health deepens, proactive measures will dominate healthcare strategies aiming to empower individuals and communities to take charge of their health. The holistic approach to lifestyle and disease will not only enhance individual well-being but also contribute to the sustainability of healthcare systems globally.